Hello friends, I'm Dr. 𝒂𝒊𝒏𝒕𝒎𝒆, Principal Director Cardiology at the 𝒚𝒐𝒏𝒃 Super Speciality Hospital, New Delhi. I'm going to talk to you today about a very important topic, not necessarily for people who already have heart disease, but how to be aware of your risk of heart disease and how to prevent heart attack. So we have so many apparently healthy individuals, and one fine day we find that they suffered a heart attack and had to rush in emergency to the hospital. And people and the family are at a loss as to why they had this problem when they were not pursuing unhealthy practices. So it's important to understand what are the risk factors which put you at risk for heart disease. And once you understand those risk factors, you can see that many of these factors can be greatly reduced. The figure which I want to emphasize to you is that based on scientific evidence, based on multiple studies, World Health Organization has said that 80% of heart attacks can be prevented, which means that if we adopt healthy lifestyle and practices and keep checking our parameters and correcting the abnormalities, then in 80% of cases, we can prevent heart attack. So then what are these risk factors which lead to heart attack? These are easily enumerated. Certain things we cannot change. With increased age, we tend to have more risk of heart attack. So a 20-year-old, although not completely immune, it is rather unusual still to have a heart attack at that age. But as you cross the age of 40, then the risk increases. Men generally have a higher risk than women, but even women who cross the age of 45 to 50 will have a higher risk, especially because hormonal changes happen around the time that menopause stops. So age, gender, then our ethnicity, our race. Unfortunately, Indians are among the racial groups that are most prone to develop heart attack. So we are, of course, more prone to have heart attack than, say, the Chinese. So these are certain things you cannot change. But there are many things that you can take care of. And these include things like what is your diet, what is your exercise level, what is your body weight, especially in relation to your height, what is your blood pressure, your serum cholesterol, your blood sugar level, are you diabetic, what is your stress level, are you exposed to pollution? So there are many factors. In fact, most of the factors are preventable or modifiable, and you have to measure them in order to know what is your level and to reduce that. So periodic checkup, including blood pressure, blood sugar, serum cholesterol, height and weight measurement, and then these can be interpreted with your doctor, not necessarily cardiologist, but even a primary care physician, and a risk assessment can be done. And if you are the kind of person who believes in do it yourself, then there are many websites which are available, and you can put your data into the website and they will give you some scary numbers which tell you what is your 10-year risk of developing a heart attack. So there is one site called 𝒅𝒆𝒕𝒂𝒊𝒏𝒕. There is another American College of Cardiology website. So 𝒅𝒆𝒕𝒂𝒊𝒏𝒕𝒎𝒆𝒏𝒕. You can put in your numbers, simple numbers, blood pressure, weight, smoking status, cholesterol level, and so on. So simple questions, and you will generate a number which, based on the data of hundreds of thousands of patients, can tell you what is your risk. Broadly speaking, whatever number comes out, don't get disheartened and try to reduce it further. And you will find out what are the factors which have made your score bad, and then you try to improve it. So this is one positive way in which one can say that instead of just waiting to develop heart attack or thinking that it is a matter of chance, one can be proactive and one can reduce one's risk. So I hope this is beneficial to you, and I would love to have your feedback on this.